Welcome to Tamarisk's training presentation regarding the dying process and our efforts to help prepare you to offer a caring presence, to be able to walk with someone to the end in a way that breathes life and brings comfort and value. We want you to be aware of what your companion might experience. Approaching the end of life will affect someone with a terminal illness, physically, of course, but will also impact their mind, emotions, and spirituality. So our goal in this presentation is twofold. First, to equip you with a basic awareness of what to look for or expect physiologically, what you may see as the illness impacts their mind and body. Second, to give you some tools that will help you as you might engage in spiritual discussions with your companion or perhaps their family. Please have your binder with you as you'll be asked to interact with a few handouts during the presentation. If you'd rather, you can pause or stop now and fill out the following handouts before you begin. The first one would be understanding your own feelings about the spiritual aspects of death and dying. The second would be spiritual aspects of death and dying, questions to consider for yourself. You'll also be asked to read Marnie's story about her experience in being with her companion when he passed away. So let's begin. Let's start by talking about some of the physical challenges and changes that are commonly present when facing a terminal illness. Don't be overwhelmed with these lists as if these are all things you need to watch out for and be able to take care of or fix personally. This is a general list, and your companion will likely be experiencing only a few of these challenges. In your role as a companion volunteer, you would perhaps be able to address and meet some of these needs. But often you would simply need to be aware and let family or medical personnel know what the patient is experiencing. Each of these general areas are addressed as Tamarisk staff meets initially with a family and on the match visit. So when you begin visiting the patient, you'll know what you need to be aware of. First of all, pain. Pain is a common concern, whether that be localized in one area of the body or a generalized pain that the patient copes with consistently. Anxiety and other emotional distress may be present as the patient copes with physical pain, or perhaps due to related uncertainty and fears about what lies ahead. As their volunteer, you will be able to help relieve pain by alerting family or medical staff that can administer medications. You may be able to address discomfort by helping them adjust their position, by offering a pleasant activity or conversation that helps to distract them and take their mind off the pain. At other training events, we have taught our volunteers simple hand or foot massage techniques that might be appropriate. Finally, as we will discuss in our training event, the Tamarisk volunteer is often uniquely positioned to help process emotional pain and fears. Breathing difficulties are common when working with patients facing ALS, lung cancer, congestive heart failure or CHF, or COPD. You'll want to keep in mind when any of these symptoms listed here are affecting your companion so that you can offer appropriate activity and support. As their volunteer, you may be able to assist with simple oxygen supplies, help them to sit up or change to a more comfortable position. Your sensitivity to how easily they tire when talking, or perhaps times when conversation is difficult, will also help make the visit enjoyable for them. You can also be helpful by being aware of how easily they tire and offering shorter walks, for example, or suggesting using a walker or wheelchair. This is a common area that changes as a disease progresses. There may be days when they are strong enough for an outing and others not. Perhaps when you begin visiting they are able to be more active, and later on at your visits shift gears to chatting and stationary activities. Digestion and the ease or ability to eat may be affected directly by the disease and at times influenced by medications. Tamarisk staff will have asked questions to explore, for instance, whether they are diabetic or if there are specific concerns to be aware of concerning food and drink. As you work with a patient who has difficulty in this area, it will be helpful for you to ask questions as you go. For as you will see, a patient's ability and desire to eat may change as the disease progresses and they approach the end of life. As their volunteer, you may enjoy helping them to prepare meals with the patient, taking them out for meals or treats, or perhaps bringing something with you to share that encourages them to eat or simply helps to build your friendship. When you are aware of any concerns with digestion, you'll be able to make good choices. For example, you may go out for a large chocolate shake with a patient who has Huntington's and needs to work to keep on weight, but choose to offer Ensure for the patient with advanced ALS who needs nutrition and has a difficult time swallowing. While offering or even preparing food is not necessarily a part of your role for each family, sharing food is a common way to build a relationship. And you can help bolster and maintain your companion's health by offering food and drink in ways that will help them. Skincare. Now, that might not be an area you think of right away when considering the effects of a terminal illness, but it is certainly something to be aware of when you are matched with the very old or frail, or someone who is bedridden or for the most part immobile. Certain medications can also cause dryness and irritation for the skin as well. As their volunteer, you can help by offering lotion and being sure to administer gently. For the companion with delicate skin, you'll need to be very gentle if offering a massage, as the skin may even tear easily or cause bruising if you're too rough. When visiting with someone who is confined to bed or spends much time in a chair or wheelchair, you can help by asking if they are comfortable and perhaps adjust their position. Of course, you need to be aware that as a Tamarisk volunteer, you have not been trained to use lifts or perform transfers, so please refrain from doing much more than offering a hand to steady or monitoring someone who is able to do much of the work on their own. Let's continue. Terminal illness can also affect the person's brain functioning and mental ability. Certainly this is the case when your companion is diagnosed with a form of dementia. And dementia is that umbrella term that refers to any condition that causes memory loss. You are most likely familiar with Alzheimer's, but of course there are other illnesses that cause dementia as well. Perhaps there's been an injury to the brain. In some cases, the disease affects the proper functioning of the brain. If the patient has Alzheimer's disease, the brain is actually deteriorating and shrinking. As a volunteer, it will be helpful for you to keep in mind that the patient's behavior or conversation that can be challenging at times are not something they're consciously choosing. Their repetitive behavior or questions, lack of social graces or appropriate words, inability to form words or complete a thought, tendency to, quote, live in the past. All of these things are not done on purpose, no more than they could choose to be in pain or choose to lose the ability to walk. So supporting a companion with dementia-like symptoms can be a challenge to know how to work with. And so we do have a number of additional resources, and at times we'll offer training so that you can feel comfortable in knowing how to support a person with this challenge. So here's a few simple rules of thumb. First of all, don't try to correct their statements or bring them back to reality. It's best to accept where they're at and assume their concern or question is valid. For example, when they're upset because Dad's not home from work yet, don't remind them that Dad died 15 years ago, but reassure them that perhaps he must be late, you're sure he's on his way. Your goal is to relieve anxiety, not to correct their memory. A second clue. It's better to guide behavior and offer gentle suggestions than to confront or ask direct questions. For example, it might be easier for them to work with you if you say, I brought your favorite coffee with today. Let's sit down at this table and enjoy a drink. Instead of saying, don't keep picking up that pitcher. Are you thirsty? Where's your favorite spot to relax? We can sit down and have coffee or soda if you'd like. And motor skills. Disease as well as age commonly affect a person's mobility. This is also an area where you are likely to see a digression over time. Again, Tamarisk staff will have gathered much information regarding the patient's mobility and will have asked if falling is a concern during the assessment. As a Tamarisk volunteer, it will help if you are honest about your ability to assist someone who may need help getting up or into a car or needs to be monitored when using a walker in case of falling. If you have back trouble, for instance, we would not want to put you, or the patient, of course, in danger by asking you to visit someone who is likely to need your support when standing or walking. While as a Tamarisk volunteer, it will be helpful for you to remain flexible over time, willing to adjust the nature of your routine or your visit as their motor skills and abilities change. Volunteer connection meetings can be a great place to gain insight and ideas on how to preserve a treasure activity, but make adjustments. I call one match that had a regular habit of outings to Dairy Queen and drives around the neighborhood. Well, as the patient transitioned from walking to wheelchair and also developed issues with incontinence, our volunteer talked with the caregiver and made the outings much shorter, and then chose to stop at the DQ on his way to bring the treat to the patient when he arrived. In general, it will be helpful for you to feel comfortable asking questions, respect their abilities, and be patient, perhaps even if things take much longer for them to do independently, but be willing to assist where needed. Your goal should be to help them to maintain as much independence for as long as they can, while balancing this with the need to keep them safe. And finally, terminal illness will also affect the patient's ability to care for themselves. The ability for a person to take care of their most basic needs can be one of the most distressing losses caused by terminal illness. It is also a very common area for things to change during the course of your volunteering with the family. Again, Tamarisk staff will have asked questions regarding toileting and other personal cares during the assessment, and where appropriate, made sure that the family understands the role of a Tamarisk volunteer. Now, we'll discuss this in the training event, so please take a moment to note any questions or concerns you have in this area. But it's important for you to understand that when serving as a Tamarisk volunteer, you are not going to be directly engaged in toileting, bathing, dressing, transferring, or any complicated meal preparation for the patient. Tamarisk is not providing the training, certification, or oversight needed to allow you to engage in skilled cares that normally would be handled by a PCA, a CNA, or a home health aide. As a Tamarisk volunteer, you will be most helpful by making sure that the patient's basic needs are being met while offering your own assistance in a way that's appropriate for a volunteer. A couple examples that may prove helpful. When visiting a patient that struggles to have an appetite and needs soft foods, it is very appropriate for you to bring them Boost with a straw or to offer to pick up their favorite yogurt for your next visit. However, you may need to politely remind the caregiver that you are unable to help the patient get showered and dressed when they ask if you can come early one day before the patient is out of bed. Rest assured that Tamarisk staff remains in contact with you and the family so that we can support and guide through any changes or challenges that come along. Again, this is also a common area for volunteers to offer support and advice for each other during our connection meetings. It will also be helpful for you to be intentional about treating the patient, your companion, with respect and dignity. An important step towards this will be your own decision to be comfortable with these changes and to decide ahead of time that their value and worth is not tied to their abilities. Well, in closing on this section of the discussion, remember again that any one terminally ill patient will experience some of these changes and challenges over the course of years or months, depending on what condition they're facing. During the training event, we'll discuss more what to look for or expect as a person approaches those last weeks, days, and even hours before death. As we transition our discussion about death and dying to spiritual matters, I'd like to take the time to share with you a unique and special journey that one of our volunteers had as she supported a family during the last 6 months of life. Marnie visited weekly with an 82-year-old man who had been diagnosed with Parkinson's 5 years previously. Please pause or stop the presentation to read Marnie's story if you haven't already, and then listen in as I talk with Marnie about her journey and how she was able to offer both practical and spiritual support to them. Well, I'm here with Marnie today and just wanted to talk with her a little bit about the experience that you had. Was it just about a year ago?
Yep, a year ago. Yep.
And I know you've had a chance, or the volunteers watching the video have had a chance to read the story that you shared with us.
Mm-hmm.
So just wanted to ask you a couple of questions kind of to help us reflect on that.
Yep.
The first one here in our training, we do talk about some common challenges that are faced with people that are dealing with a terminal illness.
Yep.
Issues of pain, mobility, different things like that. What would you say that you experienced with that family? What did you need to be aware of?
Bob's Parkinson's was already fairly advanced by the time I met him,
So he was not able to walk on his own. He fell a lot. He was very bruised when I met him, which was kind of startling. His face, his arms, and his wife had said he falls a lot. He tries to get up on his own in the middle of the night. And so I had never seen that before. That was, just, I'm glad she explained it to me, or I might have not quite understood what it was for. He would sit in his chair. He wasn't able to get up. He slept a lot. When I first started, he was eating solid foods, and so she would ask me to feed him, and sometimes it was yogurt, sometimes it was a piece of cheese or something, and then slowly that progressed into soft foods, and then into having difficulty swallowing.
Okay. And you were able to walk through those changes just by talking with his wife?
Yeah, she kept me updated on what was, every week what was new, or over time things changed. And he also had dementia associated with the Parkinson's. So for me, once he was sitting in his chair or laying in his bed, the dementia at the beginning of knowing him was more of an issue, because we would have conversations that were about where he was in his reality, which you just kind of go with.
Right.
But that was a big part of his disease. And eventually he stopped. We couldn't communicate. He stopped speaking. But at first we had a lot of conversations about
things he was in his own world, kind of?
Yeah, one day we watched Seabiscuit about the horse, and he started telling me about some of what had happened in the movie, but it was like it was a memory he had of when he was younger, so I think he was combining what he saw on the movie with memories from his childhood with what I just went with it, but it was kind of cute. It was kind of cute talking about the horses he had brought into the room or something. It was kind of funny, but yeah, dementia was a big issue for him when I first met him.
So there were physical challenges and emotional things that were part of the disease.
Yeah, he had some anxiety, which he was on medication for. He wouldn't sleep, at night for her, so she was exhausted, his wife was exhausted. And then it's just a general progression of weakness, where eventually he was in a hospital bed and didn't get up.
So now, was there anything in particular that you noticed on your last couple of visits that kind of clued you in and said, I wonder if Bob's approaching death or not? Well,
they had a hospice nurse start to come regularly, and so once he got into that hospital bed, that was a sign that, the end was near. He had a catheter. He wasn't, the week that, Carolyn had called me, his wife had called me the day before I went that last time and said he hadn't been eating or drinking for a week.
Yeah.
So that was the big heads up that, this can't go on much longer, and, I know people can maybe live 2, maybe 3 weeks without eating or drinking, but usually that's a sign. His feet had started to curl up, which is a sign. And that last morning, the hospice nurse had been there and really said there was no change. So his wife left, thinking there's no change, and his breathing was no change in that, which can be a sign. And so I wasn't worried about it, and she wasn't worried about it, his wife. So it was a surprise to both of us.
So the last question I have, obviously with the story that you shared and the conversations we had when it all happened, that day that you were with Bob when he passed away, it was obviously a spiritual experience in nature for you. Talk to us then about how that day progressed as you spent time with him, with that, just how that came around, and also how you felt comfortable talking with Carolyn about it, because one thing I thought was interesting to know, you hadn't had necessarily a conversation or a clear sense with either of them that they were religious or not. So there hadn't really been some open door to talk about those things.
Right.
So, tell us about that. What happened that last day that helped you it sounds like in your story, it's like, well, I felt okay telling her this, and then
Right,
this.
and that's exactly what I did.
Yeah.
She had left within, I think it was of an hour of her leaving is when he passed away, so it was very quickly
Yeah.
after I got there. Like I had written down, I was saying the rosary, which is takes about a half an hour, and said some other prayers, and it was just as if he just stopped breathing. I mean, there was really no other indication that I noticed. I mean, I wasn't staring at him. I wasn't, he didn't gasp for air. He didn't move it differently or anything.
Right.
So he was breathing loudly with his mouth open, and then I didn't hear it anymore. So that was sort of, I just thought, well, that's weird. And then obviously I investigated that more, and
Right.
he wasn't breathing. So by the time she got home, I knew that would be a big emotional moment for her, time for her. So I didn't say anything at all. She was crying, she was talking to him, talking a little bit to me, but really not talking to me, more just this deep sorrow. And then as she sort of settled down, I didn't feel like, I felt like I couldn't not tell her that his last moments had been very peaceful, that he didn't say anything. You know, I think anybody would want to know what happened in the last moments, if anything unusual had happened.
Yeah.
So I knew that I would tell her that when the moment was right, when she had settled down a little bit, or if she asked me about it.
Right.
And then I thought just letting her know that I'd been praying, that to me that would be important.
Sure.
And we just never talked about religion. There was nothing in the house that made me get a sense that they were religious. They didn't get married in a church. I'd seen their wedding photos, so there was just never a moment when I had felt comfortable doing that, but I just thought, even if they're not religious, it can't hurt to tell her that I'd been praying, and it was very peaceful. And she shared a little bit about religion with me after that, so I know she had been religious sometime in her life, which...
And she appreciated that? She liked knowing that you
She
had been
did.
praying.
She did. She didn't have a huge reaction, kind of a relief. She was overwhelmed with the whole situation, so any reaction she would have had would have been normal to me. Whether she cried or laughed or was mad, anything would have been fine. And then I told her a little bit later about the dream I had had, just thinking that one over a little bit more, because it wasn't, I don't have significant dreams very often. Usually they're weird and I don't think anything about it. But this one really stuck with me, and I just shared that with her. That was much later in the day, as we kind of just were there, and his body was there, and it kind of was normal. That, she
it
was...
seemed to make sense to say.
Yeah. So it was a little by little, and if she had, if I had told her about his last minutes and she would have had some breakdown, I wouldn't probably have told her anymore. She was able to hear it and not fall apart or be upset by it. So.
Now I know you were able as well to even kind of follow up over the next few days afterwards, and were able to go to the funeral, and that's really nice closure for a family, outside of just being with Bob in those kinds of moments to support him, but also for his wife.
Yeah.
And that was good.
Yeah, they didn't have any children, and his children were estranged, so I just felt like I should go and be sort of a friend to Carolyn, although she did have other friends and some other relatives that came, but just it was closure for me too.
Yeah, absolutely.
Yeah.
So, well, thanks for taking the time to talk with us. I know that's a big question I think that new volunteers always have, is how am I going to be ready for all of this? It may sound overwhelming, well, he doesn't walk, and there's this, and then there's changes with food and whatever.
Yeah.
But when you're in the midst of it, working with a family, would it be safe to say, you just kind of go with the flow? And
exactly. I learned a lot from this experience. As he got worse, a few other people I've been companions with, they just die like that, and you don't, I got to see the care she gave him, how she wanted him to be at home. They brought the hospital bed in. They had all this equipment to help him be comfortable at home. And I suppose if they had gotten to a point where I wasn't comfortable, if some part of it freaked me out, I would have just said, I don't feel comfortable coming anymore. But
Right.
And
Right.
I think that if that's how you feel, then you
Yep.
should say that
Absolutely.
if something's bothering you, or there's a lot of end of life issues that
Mhm.
maybe people aren't comfortable with, but
Yeah.
it's a slow process. It was for Bob. It was a
Right.
slow process, so I was able to sort of just take it and say, okay, this is normal for him, this is normal for him, this is normal for him, and
Yep.
and nothing's embarrassing and nothing's shameful. If he's got a catheter, he's got a catheter. If he's
Yep.
talking kind of crazy, he's talking kind of crazy. So you just go with it. Yeah.
Absolutely.
Yeah.
Well, thanks, Marnie.
You're welcome.
And thanks, Gabby, for allowing us to visit.
I hope Marnie's story and video gave you a sense of some typical physical challenges that you may encounter, and also how spiritual matters naturally are a part of the journey when supporting someone near the end of life. One of the uniquenesses of Tamarisk's volunteer support that I hope we emphasize more than once during training is that the Tamarisk volunteer is often uniquely positioned to offer spiritual support and emotional support to the patient and at times to the caregiver and family. You see, as a Tamarisk volunteer, you are not given an agenda or a list of tasks that you must accomplish during your visits. Our only assignment, if you will, is to offer presence, to be there in whatever way is most helpful to the patient. There may be other professionals, such as a nurse or aide, coming to visit, but each of them, while offering a valuable and needed service, have a specific reason for their visit and a set time frame that they need to fit that visit into. Even if they have the desire, they are not in a position to offer the time and listening ear. It is also common for patients to prefer sharing their concerns and fears with someone outside the family. Now, that might be out of a desire not to burden their loved ones any further, or perhaps a family dynamic present where they don't want to share these things. Whatever the case, you, as that safe outsider who visits with no set agenda or clearly prescribed time limit, are uniquely positioned to offer emotional and spiritual support. So with that in mind, we want to help prepare you to engage in these discussions in a way that both you and the patient or their family can feel comfortable. Now, much of the content for these last few slides comes from a training event for Tamarisk volunteers given by Faith Community Nurse and nurse educator Joanne Westman. So let's begin by discussing some factors that will be helpful for you to be aware of when considering spiritual conversations with the dying. First, simply some situational realities. You and your companion likely don't know each other very well. This can make bringing up the very personal topic of spirituality more challenging, but it can also be a natural conversation topic starter to get to know someone and to see where it goes. You may find that some people don't want to talk about personal feelings. Others may surprise you by how open they are and by how much they've already thought about some difficult questions. You see, dying introduces a specific poignancy into conversations about spiritual things. Matters of faith and what happens after one dies become more important, and so you may be surprised by how easy it is to talk about these things with your patient. Second, the nature of God talk, if you will, is a factor to keep in mind when bringing up spiritual conversation. Now, it's often said that the two taboo conversation topics are religion and politics. Well, personal beliefs are just that. They're personal. And so it's likely to have a natural hesitation for you as well as for your companion to talk about those things. We all know that beliefs can be very deeply held, and so at times spiritual conversations can be divisive. Well, if you find yourself in a situation where you and your companion see things of a religious nature very differently, it just might not be the best conversation topic, and that's okay. On the other hand, and a more positive note perhaps, for those of us who come from a Christian perspective, there is the belief that when we talk about God, we know that His Spirit is in our midst to help us and to guide the conversation for the good of both you and for the patient. And of course, the personal characteristics of both you and the dying person will play a part in any spiritual conversation. For the person facing a life-threatening illness, there are many physical and emotional changes and challenges that impact and interact with their spirituality. How your companion is feeling physically from one day to the next might influence what day to hold that personal conversation. Being sensitive to your companion's emotional state might be a helpful cue. Perhaps their depressed mood is due to some fears or concerns, and your conversation can be crucial to helping them resolve some important questions. On the other hand, perhaps that spiritual conversation would be best to wait for when they're in a more upbeat mood. As you get to know your companion, you will have a sense of how best to support them. But please don't ever be afraid to ask a question or test the waters with a discussion topic. If that's not what they want to talk about that day or ever, you can simply shift gears to something else. And as the volunteer coming in to support the family, you are an outsider, a concept that carries over from our discussion of family dynamics. No matter how well you get to know your companion or how close you get to the family, you must know that you've never been a part of their history or shared their family experiences over a lifetime together. There are both advantages and disadvantages to this fact, of course. We've already stated that you just might be that safe outsider for them to talk with. Being an outsider opens the way for you to ask questions to get to know them, their family, and their beliefs. And it may be easier for them to hear a suggestion or change of perspective from you than from a close family member. However, if your background, your culture, your beliefs are quite different than your companions, it might be more challenging as an outsider to have a good spiritual conversation. Of course, your personal beliefs and experiences of God and those of your companion will impact any spiritual conversations you have. In your training binder, you will find some reflection worksheets that we've included to help you connect with your own beliefs and understandings of the end of life. It is important for you to be aware of your own beliefs and thoughts about these things, and to think about how comfortable or not you would be in discussing these things with others. If you haven't done so yet, please take a moment to pause or stop the presentation now to fill in the following handouts in your binder. The first one, understanding your own feelings about the spiritual aspects of death and dying. The second, spiritual aspects of death and dying, questions to consider for yourself. I hope that these worksheets have helped you understand yourself better and perhaps a sense of your comfort level in holding a spiritual conversation with your patient or their family. I want to be sure you understand that it is perfectly okay for you as a Tamarisk volunteer to politely disengage from this type of conversation if you'd rather not go there. But if that's something that you have some level of comfort or even a desire to talk about spiritual things, then these last two slides I hope will help you to do that well. First of all, it's important before you begin to understand yourself. Being aware of your own experiences surrounding death and how these have impacted you positively or negatively will help you be ready to be an understanding and objective listener as you realize that each of us will react to the idea of our own impending death differently, just as our own reactions to journeys of grief are different. There may be times that sharing about your own experience is helpful to the patient. Other times when your own experiences are too difficult to share, and so you choose not to bring them up. As you reflect on your own experiences surrounding death, it will help you to be prepared for any spiritual conversations with Tamarisk families if you consider how your own religious traditions have been a part of them or not, and how they may have formed your ideas and expectations at the end of life. If you're a person of faith, we want you to feel comfortable sharing about your experiences and beliefs as a Tamarisk volunteer, as long as this is invited by your companion. And likewise, if that's not been a part of your experience, then you should feel just as comfortable about sharing from your own perspective in ways that are invited by your companion. So no matter your experiences or background, of course I want to emphasize that we want you to feel free to engage in any spiritual discussions in ways that you are comfortable with. As a Tamarisk volunteer, you should never feel pressured to talk about things that you are uncomfortable discussing or don't feel prepared to address well. We do at times have requests from our families for a volunteer that will read the Bible or maybe pray with them. As a Tamarisk volunteer, you are certainly free to and encouraged to do that if you'd like. but also want you to feel comfortable in letting the program director know that you'd rather not have to have that be a part of your support for a family. The bottom line here is to remember that your role is to be present for them. However a spiritual conversation comes up or continues, your goal and role as a Tamarisk volunteer is to value and to affirm the patient. So here's a helpful list from Joanne Westman that comes from her years of experience in being with families at the end of life. Now I won't read the list for you, but invite you to jot down some ideas of your own that you can share with the training group and give you a moment to read and to reflect on these ideas. So as we come to the close of this discussion, I'll address two final questions that perhaps have crossed your mind. First, well, what's the goal? Why are spiritual conversations so important that we'd spend time in training talking about them? First of all, the goal is simple, that you are off to a good start if you can simply meet them where they're at. Whether matters of faith or questions about death are very important or not at all to them, or cause them great anxiety or great peace, your role as a Tamarisk volunteer is to leave your own agenda or expectations at the door and walk into conversations in areas of their lives that they invite you into. Hopefully your training will help you be prepared to feel comfortable entering into those conversations if and when they happen, because you've already thought through many of your own questions or fears about faith, death, and the end of life. Another goal to keep in mind when engaging in any spiritual conversation is for your words, actions, and demeanor to bring a calming and caring presence. Now, of course, we understand that there's no way you can guess that something you might say would upset your patient. Well, perhaps at times the way through a difficult question is to be the person who's willing to encourage them to face anxieties and talk through the fears that eventually lead to peace. It's important to keep in mind also that simply listening without an agenda goes a long way in showing how much you care, and knowing that someone truly, quote, hears what they feel can very much calm their emotions. Your best gift to your patient may be at times to say nothing and just listen and affirm. Our final goal, well, no matter the extent or length of any spiritual conversations with your companion, a key goal for your work as a Tamarisk volunteer is to help that person be prepared for a peaceful death. If your conversation, a book you give, a family member you help them connect with, maybe a referral to a chaplain or pastor, for instance, if any of those things that you might do help them resolve questions, tie up loose ends in relationships, work through challenges they face as their disease progresses, you have indeed done a great work and truly have been a blessing to this person and to their family. So finally, that last question, what are our expectations for you in this area as a Tamarisk volunteer? Well, first and foremost, be yourself. We don't expect you to be a Bible scholar, a chaplain, or a prayer warrior. But if you are and your companion would like you to share in that capacity, well, feel free to do so. And of course, we expect our volunteers to value and to respect the dying person and their family, no matter what their background and beliefs are. We hope that this training prepares you to be willing to engage in spiritual discussions according to your beliefs and your comfort level. And finally, we expect that when it's appropriate, you'll contact Tamarisk staff to offer a connection to an additional resource or support for spiritual care when needed for your companion. So in closing, I hope our discussion here has equipped you with a basic awareness of what to look for or expect physiologically near the end of life, and that you have some tools that will help you as you might engage in spiritual discussions with your companion. So please take a moment as you complete the presentation to make a note of questions or comments on your handout, or complete any of the reflection worksheets as needed so that we can have a great group discussion about this topic. Thanks for joining me.